All right, and this is where we have to cover the differences between the sexes. So what do we have here? Male or female? Well, this is the penis right here and the testes right here. Again, I have to remove the images. They're on your Lalima slides because I'm not sure on Twitch's educational nudity policy, but I'm playing it safe here. All right, so here's the bladder. It's filling up with urine. Now, remember, we do have that internal and external urethral sphincter. So the urine is going to go, once that's relaxed, these sphincters are relaxed, then you have the urine flowing from this high pressure to low pressure and out through this external urethral orifice. Now here in the female anatomy, so what do we have here? Well, we have the urinary bladder here, and we have the vagina. So yeah, there's always a few, but some people actually think, okay, it comes out of the same orifice, it comes out of the same tube, and it's like, no, they're actually separate pathways. So yes, the thing is that the vagina and the urethra are not the same thing in females. Even though like the reproductive systems are connected in males, they're separate in the females. Now what we have here, so again, we have the ureters, and then they carry urine filling up the bladder. And women also have an internal and external urethral sphincter. So both sexes do have a double seal. They have that internal and external sphincter. Now, what happens? So this is the uterus, and say a woman is a pie, she gets pregnant. What happens then? Well, again, the uterus has to expand to accommodate the baby inside. But where is the baby sitting on? Yeah, the baby's sitting on the uterine bladder right here. So what if you have all this little baby kicking around, moving around, and causing all this pressure over here? Or if the woman's upright, where's that weight of the baby going to transfer? It's going to transfer onto here, right? So ask anyone who's ever been pregnant or is pregnant how their bladder. I mean, if you're really close to them, that they will often tell you like, I have now I'm like have problems holding in. I'm urinating more often, but why? You have all this additional weight up here, all this pressure. So this is going to cause this sensation of like, hey, maybe I have to urinate. Or worst case scenario, if something is really affecting her muscle tone right here in the external urethral sphincter, she might get a little leakage of urine, maybe a little incontinent. So yeah, that's often seen. And this is a great. I saw this tweet. So what did your wife do before she had the baby? And then yeah, so it's like, so I mean, that's another thing women who have given birth might tell you. Not only do they have some difficulties or little blips with urination, but also number two, they also have problems with defecation as well. But why does that happen? Well, again, look at the location of the uterus. The uterus is between the bladder, so we know how this baby is causing the increase that incontinence. But look right here, right? What you have the bladder right here. Well, we have the rectum and the sigmoid colon down here. So what often happens during pregnancy, if this baby's coming out down here, what is that going to do to the? Well, we know it's going to cause pressure on the bladder, but it's also going to cause pressure back here, right? So as the baby moves out and it causes pressure down here, it's eventually going to squeeze it. If there's anything in here, it's going to squeeze it out like a toothpaste tube, right? So again, I totally believe that story, and again, this is why this happens, and it's one thing the OBGYNs don't tell you, or the nurse midwives don't tell you, is that yeah, this is kind of not too unheard of. If there's anything in here, if you have this big 8-pound baby just moving right here, it's going to squeeze all the contents here, and voila, you have that little surprise at the end.